Okay.
So I'm going to talk about the breath test that Hunterdon Digestive Health Specialists offer here in the office. So the first thing is the test is covered by most of the insurances. We offer 3 kinds of tests. The first one is called SIBO. SIBO stands for Small Bowel Intestinal Bacterial Overgrowth. This test is done to detect excess bacteria in the small bowel that may be causing your symptoms. The second one is called lactose tolerance test, which is to see if you have any intolerance to lactose, which is mainly dairy products. And the third test that we offer is fructose, to see if you have any fructose intolerance. Now for the SIBO testing, what we give is what we ask, actually we give you the script for the lactulose, which you have to get it from your pharmacy, and you have to bring it here in the office. Similar with the lactose, you have to bring 16 ounces of milk and you are going to drink it here to perform the test. And with the fructose test, you will have to have some soda. So when you come here, you're going to spend 3 hours over here, because what will happen is you stay here, you give yourself a challenge, and then you will drink, and then we'll take your breath every 20 minutes. For all the tests, basically the prep is the same. So what happened is, once you are scheduled for the test, 7 days prior to your test, you have to prep. We give the patient this is the instruction sheets, and it tells you what you need to do 7 days prior, 1 to 3 days prior, and then it's 12 hours and the day of the test. So we recommend that you follow the instructions carefully, because if you are not able to do so, then the test might not be accurate or valid. So it's always recommended, please follow the instructions carefully before the test. All right. And then, so when you come in our office, what I'm going to do is, this is the sheet. We have your name, your date of birth, your weight. If you have any allergies, why we ask that? Because based on your test, if you seem to, if it's positive for any bacterial growth for the SIBO testing, then we have to order the antibiotics. So we put it here, and then first would be the step would be the baseline. So what you will, when you come, I'm going to show you on the machine, which is called the gastrolyzer machine. You will take a deep breath in, and then you hold your breath, and then once it asks you to blow, you blow in the straw. So that would be your baseline. And then after baseline, we'll ask you to drink the solution depending on what kind of a test you are getting. And then after that, you will take the breath test again, and then after that you will be testing it every 20 minutes for 3 hours. Okay, now since we talk about the sheet and the instructions, am I not missing anything? Let's go to the machine. So this is the gastrolyzer machine. This is the main machine that we are going to record the test. So this is the machine, and this is the straw. What I'm going to do is, I'm going to take off the paper from here. I put it in here, and then I remove the paper and throw it away. All right, now this is the on and off button. So I'm going to on this machine, and then I go push the home button, and then you see 3 pictures here. So I'm going to hit this guy over here. Let's see why. Okay, so this means the machine is calibrating. So we wait for a few seconds until it calibrates.
Don't worry, I can cut all this.
Yeah.
Just go to the next screen when it does.
The next screen, and you see a guy, and now the clock is ticking. So when the clock starts ticking, you have to take a deep breath in and hold your breath, and you keep on holding until you hear the beep sound. 4, 3, 2. You hear the beep sound, and then you see the guy asks you to blow. You blow the air over here. Should I? Okay. Now you see the numbers are blinking. So you will wait until the number is stop blinking. So the number, when it is stop blinking, that's the number that you record over here. So this is the baseline. So now you see the number has stopped blinking. That's the number you record, and that's your baseline number. So I put it here. Now, also this is, you see, it's a symptom. So if you feel any kind of symptom during or throughout the test, like nausea, dizziness, headache, anything, you can notify it over here. Alright, so this the baseline reading is done now. What we have to do is, let's just pretend that I have the solution that I'm going to drink. If I'm doing the SIBO test for the bacterial overgrowth, I will have the lactulose solution. It's around 10 gram per 15 ml solution that I'm going to drink the whole bottle. If I'm doing the lactose tolerance test, I will drink the whole milk. And if I'm doing the fructose, I will drink that 1 can of soda. After I finish drinking, I will just do the test again. So we start the test again by clicking on this guy over here, and then the clock starts ticking. So I take a deep breath in and I hold my breath. And when you see the sign asks you to blow, I blow again, and then again I wait for the number to stop blinking, and that would be my reading for my test. So when it stops blinking, that would be the reading for this test over here, second reading after the baseline. And then then every 20 minutes you have to repeat the same same steps every 20 minutes for next 3 hours. And once you complete the test, the doctor is going to review the test, and based on the results, we will call you to come, and then she will discuss the treatment, if any.